Welcome back to CLE Weekend. You know, chronic conditions, they affect millions of people. It's every day, and they are actually the leading cause of death here in Ohio. Managing these conditions, it can be challenging, but with the right care, you can take care of yourself and take control of your health. Joining me today is Buckeye Health Plan Medical Director, Dr. Michelle Blanda. Good morning.
Good morning. Thanks for having me.
Absolutely. So let's start with chronic conditions. I mean, what are some of these?
So chronic conditions are a health problem that is going to stay around for a while. So examples of this are heart disease, diabetes, chronic kidney disease, respiratory conditions, and even some cancers. They're going to be with you for a while and they're going to need care. So we want to get people ready to be able to care for themselves. They are the leading cause of death and disability. It's said that 6 out of 10 people in the United States will have one chronic condition and 4 out of 10 will have 2 or more. And so they are really going to impact your life. So we want to prepare people to how to manage them.
And it's not only impacting your life, but it impacts families too.
Correct. So families will really be stressed by this. You know, the idea that you have someone in your household who's sick, who's going to need extra care, there may be extra medications that they have, extra doctor's appointments, things like that really stress them out.
Now, when we're talking about family, is there a family history component that kind of has an influence in this?
So hereditary history is really important. So some conditions like diabetes and peripheral vascular disease and heart disease and some cancers will have a hereditary or familial component, especially if you talk to your family members and you find out that they were diagnosed when they were quite young. And so if you have that history, you want to make sure that you share that history with your doctor so that they're aware that maybe you need extra screening and you need to be watched to see if you're going to get these conditions.
Absolutely. I feel like yesterday, you know, maybe 4th of July, we were with our families. It's something to talk about because you need to know your family's history. Are there things that we can do that would maybe help us to not have to deal with some of these chronic conditions?
So the biggest thing is prevention of chronic illness. And so we've discussed it before, you and I, about the idea of, first of all, you have to eat healthy. You know, so you don't want to be drinking a lot of soda, you don't want to be eating a lot of processed foods. The other thing is you want to stay physically active. You know, even when people have like arthritis and stuff, being active doesn't mean I'm out running. It could be doing something in my chair or lifting weights or doing something different that's not having so much impact on your joints. The other thing is, you know, you can't smoke cigarettes, you can't use tobacco products in any form, you know, the other forms aren't safer, and you want to limit alcohol consumption. And the one thing that we forget about is, you know, visiting your doctor, seeing the doctor to make sure you're getting your annual wellness exam and you're doing any preventative screenings.
I think that's important too because I find with like my husband, sorry men, but sometimes it happens, right? You've got to hound them, please go in, and they're like, I feel okay, but there's a difference in feeling okay and actually going to get these checkups and see your doctor. You have to go. Now let me talk to you about families and how we said this is going to impact them and how they are, but what's the best way to kind of manage this? It's with your doctor, and I mean, would you bring a family member maybe with you?
Oh, for sure.
Okay.
You know, having an advocate is always important.
Good.
And so family members are the best advocates. And so having the family being involved, they can give you emotional support, they can help you with medication, they can help you with doctor's appointments, and sometimes just having talked through like with your family member prior to going to the doctor's appointment, you'd be surprised how many questions come up that you think, well, you should ask the doctor that. So it is helpful to have that discussion.
Well, and you had mentioned, I mean, some people have 2 of these chronic conditions. And I mean, that is a big deal. You do need help. So whether you say it puts stress on the family, but the person who's dealing with these 2, it can really be helpful to have another person to deal with this.
Right. So it's important to use your family members and to have them give you the support that you're going to need.
Okay, so let's talk about Buckeye Health, because what is it that you guys are doing to help people, especially manage these chronic conditions?
So Buckeye Health Plan is really committed to helping people manage the chronic conditions they have and having a happy and healthy lifestyle. So there's multiple things that we do. First of all, you know, if you have Buckeye Health Plan, you are going to get high quality care at no cost. The other thing that we do is we have, if you need specialists or special type of doctors, you can go on Find My Provider tool on our health plan website, and that will help you navigate. Some people need a helper to navigate. Maybe their family isn't able to help them navigate. And so care management is offered. And this is like a special person who's dedicated to you, who knows your health history, and will help you navigate the healthcare system. There are other things that they offer. They offer the MyPay Awards that gives you financial incentives if you go to the doctor. They have a 24/7 nurse advice line that will also help. They have different things like transportation benefits that will give you resources to allow you to get transportation to go to the doctor, to go to the pharmacist. And they're very good at helping with community resources if people are really struggling with housing or food or other things like that.
Wow. So you, just said so many benefits, so many things. Just another reason why you should go to BuckeyeHealthPlan.com. Thank you so much, Dr. Blanda. You're always good with this information, and I always walk away like, okay, I got to check on myself, the people in my life. So that's always so important to do.
It was my pleasure. Thank you.
Thank you again. We'll be right back on CLE Weekend.